So, a lot of people, they come to the dentist and they kind of avoid seeing us, but they wait till something hurts. And so, that usually turns into a dental emergency, so to speak. So, when I talk to my patients, when I see them, I try and assess what's going on. And I tell them, 5 things cause pain. Number 1, infection, right? Your face swells up, you're in a lot of pain, it hurts all the time, can't bite on your teeth, keeps you up at night. That's usually a sign of infection. The second one is like a cracked tooth. You split the tooth or you chip the tooth. Chipped teeth don't necessarily hurt, but when you fracture a tooth and it's into the bone, it can be very uncomfortable. It really hurts when you bite down, but when you don't, you kind of have a dull ache. So those are situations where we have to assess, what to do. The third one is usually a cavity, right? Sometimes sensitive sweets, hot, cold sensitive. And hopefully we can fix it if it's not too big. But that's, usually the sensation. You don't have any swelling, but it just hurts to sometimes bite on, or you get that sensitivity from candy, or when you're drinking, an ice cap. Number 4 is trauma. My cousin, he was playing basketball one time, turned, and the ball hit him in the face. And his tooth ached for a few days. Usually with trauma, you bite into a hard nut, things like that. It's like a bruise. It'll be sore, be sometimes quite sore, but next day it will get better, and then usually goes away. And so usually that sort of treatment you can kind of postpone, take some painkillers, and it should settle itself. Now lastly is occlusion. We don't necessarily think about it. I've seen people, my first experience with a bite issue was a lady when I used to work out of town, an hour away. She was calling me, she was in so much pain. I told her to take some Tylenol 3s. It still didn't help. And this was a long weekend, so she just couldn't wait. So I actually drove out Sunday afternoon, an hour out to the office, saw her. She's just like, I can't bite on my teeth. I can't touch my teeth. It just hurts so much. So I just shaved her tooth down. End result, that was the problem. Her bite was off. And, I think that's the most conservative thing, So when I see patients and they come with pain, that's the first thing I think about. I try and see if I can, just do the minimal amount to adjust their bite and just to get them out of pain. The last thing I think about is, I got to pull out a tooth, or I got to do root canal. I don't think most times when I see patients, that's not the reason why the tooth is hurting or you're in grief. So, those are approaches that we try and take at the tooth doctor, is to be conservative, to make sure that we're doing the minimal treatment to get the best results.